Well, everyone has a sleepless night now and again, but when does it become a serious issue that could affect your health? To discuss insomnia, we are joined by Andrew Holmes of Sleep Efficiency. Good morning, Andrew.
Good morning.
A lot of people, I believe, suffer from insomnia. Is that the case?
Yeah, so insomnia is essentially a sleep disorder that's characterized by the inability to initiate and or maintain sleep. A lot of studies have shown now that getting less than 6 hours of sleep per night on a regular basis can really put us at a host for medical complications and concerns. Everything from obesity to heart disease and stroke, depression, diabetes. It also lowers our overall level of our immune system. So the likelihood of us catching a common cold goes up substantially if we're getting less than 6 hours. So people who have insomnia are definitely in that bracket where a lot of different risks start to come into play here. So we're going to talk about insomnia. There's a couple different types, and we're going to touch on those to shed some light on the subject.
You said under 6 hours. Are you automatically considered to have insomnia if you don't get less?
No. We'll talk about that as we move through some of the different types, because there are different ones. But
okay.
Again, the recommended amount should be somewhere between 7 and 9 hours, but all the stats have shown that if you're getting less than 6, that's when the health complications start to come into play.
Okay, so we're going to go through the different types. I didn't know there were different types of insomnia. The first one, acute insomnia. What is this?
So acute insomnia, this would be a brief or episodic type of insomnia where it's usually due to an external kind of stressor. Maybe there's been a death in the family or the loss of a spouse, and now you're trying to sleep and you don't have that partner there beside you. So again, it's usually over a brief period of time. We're talking about maybe 2 to 3 days, for maybe lasting up to 2 to 3 weeks. Maybe it's due to a loss of a job and now the financial hardships that come with that keep you up at night. Mm-hmm. So again, it is very brief, it's episodic, and about 30-35% of the population would experience this at some point during their life.
Okay, the next one, chronic insomnia.
Chronic, obviously a much more serious kind of condition. These people, we're talking about 10% of the population, and people with chronic insomnia have really had a history of poor sleep patterns. This is something they may have been dealing with for 5 years, 10 years, even 20 years. So these people are actually getting less than the required amount and less than 6 hours of sleep per night for maybe 3 to 4 times per week and extended periods of time over 3 to months at a time. These would be the minimum. So they're having a hard time falling asleep. Maybe they don't fall asleep till maybe the last couple hours and now they have to get up and go to work, or they've fallen asleep and after an hour or two they're unable to go back. So again, these are people who have maybe had a lifelong concern here.
Okay. Comorbid insomnia.
Right. So comorbid insomnia. This is insomnia that's occurring due to another maybe medical condition that's occurring at the same time.
Okay.
So people who suffer from back pain or arthritic pain. It's not due to anything directly involved with their sleep, but it's due to another ailment that's happening. Maybe they're recovering from a hip operation or a knee operation, and they're forced to sleep in a very specific position, and that can be difficult. You can imagine staying in the exact same locked-in position for the entire night. So that can cause some insomnia occurring as well. So again, it's insomnia due to an extenuating set of medical conditions.
I can remember pregnancy probably falls under that one when you don't sleep very much at all. So there's types of treatment for insomnia. Let's take a look at them. Relaxation training. What is this? Right.
So we're talking about very kind of surface levels of treatment here. Relaxation training would be maybe some breathing techniques, meditation practices, maybe listening to some audio kind of cues. There's something called the 4-7-8 method that's starting to get a little bit of publicity, where we breathe in for 4 seconds, we hold for 7, and we exhale for 8.
Okay.
And it's kind of, again, a breathing practice, and what it's shown to do is reduce your heart rate, lower your heart rate, and allow you to kind of drift off to sleep. And again, what it's doing, it's distracting you a little bit from maybe some of those external stressors.
Someone gave me a good tip once, and I do it a lot of times at night, where I get into bed and my mind's racing and I still can't put away the day. Mm-hmm. I take a really big deep breath in. I don't hold it for any length amount of time, and I just kind of blow it out of my mouth, and I just feel like that is me letting go of my day. So it's my transition from all the busyness of the day into relaxing and telling my brain it is time to sleep now, because sometimes I feel like you actually have to tell yourself to sleep.
Yep, you do. You've got to kind of step away from it.
Stimulus control?
Stimulus, what we're talking about here is the bedroom environment for starters. We really want to have a bedroom that's conducive to sleep, and really limiting the amount of activity that takes place there. So when our body arrives in the bedroom, it knows that it's there to sleep and not do anything else. It associates it with sleep. So maybe getting rid of reading in the bedroom, TVs, absolutely. We're getting into kind of sleep hygiene techniques here, where good sleep habits. So going to bed at the same time, getting up at the same time. If you have difficulty falling asleep, removing napping altogether. If that's a problem. You shouldn't be napping at all if you have trouble. So again, we're talking about some sleep hygiene habits here.
Okay, and medical treatments.
So we'll talk about this one briefly as well. The first thing you should be doing is having a conversation with your family physician. You want to open up that dialogue. Medical treatments, there are hypnotic benzodiazepines from a pharmacology kind of point of view. There are melatonin that you can acquire over the counter now that people can use. We produce melatonin on our own. It's our sleep-inducing hormone, but people can use this as an aid. But we really want to be careful here is that we're not really creating anything habit-forming.
Right.
There's really no substitute for a natural sleep. So, if you're going through some of that acute insomnia where there are external stressors, maybe using the medical treatments as a short-term solution, especially if you're self-diagnosing. But again, what we should hammer home here is if there's patterns that are starting to form, really start with that conversation with your family doctor. A referral to a sleep specialist would be a good way to go as well.
Okay, as always, Andrew, some really great advice. There is nothing better than a good night's sleep. We feel better overall. We just function better.
That's very true.
As a mom of little ones who works at 3 o'clock in the morning, I certainly can attest to that. All right, Sarah knows all about that too. And she also knows that when you get out and exercise, that can help you get a good night's sleep. Sarah loves to get out and move. Tennis today is what she's doing. Hi, Sarah.